Greetings, it's Eric back at the Naturopath. Let's talk about chronic recurring yeast infections. Why do I keep getting yeast infections? What can I do about it? How can I prevent these yeast infections from affecting me in the future? For the longest time, I've been getting questions about chronic yeast infections. This is one key area I've worked on now with patients for quite a long time. And since I was retired from practice in 2019, I've been focusing more on online education, particularly on YouTube. So let's talk about chronic yeast infections and give you some good solutions. I think it's the perfect time to address this. So in today's video, I'll be doing a deep dive into the various facets and aspects of recurring yeast infections. We're going to start with the causes and risk factors. That'll set a bit of a foundation. And then we'll find out together about ways to stop these yeast infections, to treat them, and the most importantly, to prevent them reoccurring in the future. So please stay with me till the end of this video, because I want to talk to you about better management of chronic yeast infections. I'll also want to answer some of your important questions that many of you have been asking me now for a considerable period of time. So what are chronic yeast infections? Well, today we'll be talking predominantly about male and female yeast infections, including jock itch, areas that, yeast that affects the private areas, vaginal yeast infection. A similar advice I'm giving you now will relate to yeast infections covering all parts of the body, but we're talking predominantly today about male and female infections. So Candida albicans is what we're likely talking about, but there are many species of Candida that can affect you. But Candida albicans is one that commonly inhabits the gut of many different people. It also does inhabit other parts of the body, predominantly the digestive system. It can be found vaginally in women in very tiny amounts, kept under control. But so 75% plus of people have Candida as a normally occurring species in their gut, but you must remember it's kept under tight control by other bacteria as well, which collectively we call the human microbiome. So if we look at vaginal infections, it's estimated that between 1 up to 1.4 million outpatient visits occur annually for these vaginal infections in the United States alone. So in women, it can be a real problem. The condition can migrate from the large intestine, so the yeast can travel there to the vaginal area. But remember, this is not just a woman-only problem. It can also affect men and children. So there are many different forms yeast infections can take place in people. Thrush, vaginal thrush, oral thrush. There can be intestinal thrush. There can be yeast infections of the skin. Ringworm, for example, is a type of a yeast infection. Yeast infections can cause bad indigestion, stomach discomfort, small intestinal bowel problems. So SIBO can also be a fungal problem as well as bacterial. Jock itch, toenail fungus, ear fungus. There are many different conditions we're talking about. Now, we've covered a major part about the symptoms of chronic yeast infections in a previous video. So I'd suggest that if you want to know a lot more about all the signs and possible symptoms, to have a look at the other video. So why do yeast infections recur or return? And why do they become chronic in people? Patients with persistent yeast infection problems often ask me why and how does the yeast infection recur and become chronic even after a successful course of treatment. Well, there are many reasons why you're facing long-term yeast problem, but let's look at some of the key reasons. So if we look at DNA sequencing, which is now only quite recent, we can look at studies on DNA sequencing of yeasts, and it was observed that families of patients with chronic yeast infections can have gene mutations that make people highly susceptible to contracting a yeast infection. So there can be a genetic link there as well. But more commonly, I'm looking at things in the clinic like a history of birth control pills, oral contraceptive pills containing synthetic hormones. If we look at estrogen, for example, we know that when we've seen through research that when women have high levels of estrogen in their body, natural or synthetic, that it's going to stimulate a vaginal production of more sugars, which yeast likes, so that can really make a yeast infection take off. We know that estrogens can even bind to different types of Candida, which can cause estrogen progesterone imbalances. We can shoot progesterone up, so we can create all these hormonal imbalances, which can really stimulate yeast infections. Other areas that we're looking at why they recur can be because many women use intimate washes, for example. These could contain dioxins, which also stimulate yeast infection. So I don't recommend the use of these kinds of products at all. So according to Mayo Clinic and lots of other research, sex transmits Candida infections between partners. This is something I've routinely seen in the clinic. So about 12 to 15% of men complain of having itching in their private area after having intimacy with a woman who's been affected. It's just about 1 in 10 guys can actually contract, jock itch from their partner. So for that reason, obviously, personal hygiene plays a very important role here. And I've always maintained this in my YouTube videos, that it's very important to wear the appropriate clothing, 100% cotton clothing that breathes. Keep nylon and synthetics away from the skin. Avoid wearing wet swimming costumes, synthetic innerwears and panty liners, because these all encourage yeast production, yeast growth. So bathing twice per day and changing undergarments twice per day is a very smart move for men and women who have this condition, particularly if you live in hot climates. Many of my patients over the years I was seeing either came from the Middle East, from the tropics, from the Philippines, from Indonesia. My clinic had at one stage patients from dozens of countries, all on Skype. It was incredible. So remember personal hygiene. It's a very big one, particularly if you live in hot climates. Okay? So underlying diseases like high blood sugar, people with blood sugar diseases and diabetes, for example, people with unhealthy lifestyles where they consume processed foods or alcohol daily, these things contribute to recurring yeast infections. Living in hot climates, drinking sugary drinks. What about women going through menopause? They're also vulnerable to chronic vaginal problems. So research published state that postmenopausal patients with recurring vulvovaginal fungal colonization tend to have the more aggressive and resistant fungi too. And especially older women, if they've been treated recurrently with fluconazole or drugs, the bugs just become more and more resistant. No different from, bad people digging in mountains in certain countries after they've been repeatedly shelled and bombed, when you think about it. So what about the 8th point, hormonal changes during pregnancy? So women can have hormonal levels all over the show during pregnancy, particularly in the early stages, and this can really also encourage yeast infections. Chronic and persistent UTIs and yeast infections can occur. Yeast infections also triggered, in my clinical experience, very much by chronic steroid usage and various medications. Antibiotics are likely one of the biggest causes I've seen in my clinic in terms of Candida infections. I know that antibiotics caused my own yeast infection a long time ago, and I've seen this with thousands of patients over the years. In fact, I can easily say that 30 to 40% of my caseload helping people with Candida involve people who are taking antibiotics for weeks or months or even years on end. But also steroids. If you're on prednisone, you're taking prednisone every day for an autoimmune condition, you're suppressing your immune function, you have a higher potential for a yeast infection. These drugs lower your immune function as well, and when you lower your immune function, you heighten your susceptibility to bacterial and yeast infections. One of the biggest ones I've left for last is chronic and perpetual stress, which really works hard on our HPA stress axis, our hypothalamic pituitary adrenal axis. Our adrenals have to produce increasing amounts of cortisol and stress hormones. So as cortisol gets liberated and produced, a particular thing occurs in the liver called gluconeogenesis, where sugar is broken down in the liver, made into sugar because of cortisol, and then insulin has to somehow get that into the cell for energy. And this is often why stress makes people fat. Stress makes people tired. Stress makes people sick. Stress can cause many different diseases. And I see this very much with chronic recurring yeast infections, stressed patients. So let's look at some risk factors now. What if you don't stop this? Many people remain unaware of their condition and delay treating the yeast infection. Some just pass it off as a bit of an itch or not much of a problem. But remember, there are some concerning risks that come with this condition. Now, this is not scare tactics. I'm not here to bully or scare people, or I'm just telling you things that I've seen in the clinic. So when yeast infections keep going, they cause itching and rashes, and they pose skin problems if left untreated. So the infection can also travel and infect other parts of the body. Inflammation occurs around the area. It becomes red. And as the rashes and inflammation continue to harm the skin, it can crack and scale at an exponential rate. A bit like what we see with psoriasis, which is also very much a fungal condition. So the skin of the affected area gets flaky, starts to break down and shed, and after cracking, this open area, it's like the borders are open. A floodgate of germs and other bugs can come into the system. So if your immune system's already weakened previously, and we get this breach occurring, this broken down skin, it leaves you wide open and vulnerable to many different types of infections, and your overall health gets hampered as a result. So constant fatigue and lethargy is a risk factor. According to a study I looked at recently, it was proposed that chronic yeast infection can be an agent which leads to immune depression in chronic fatigue syndrome patients, and therefore it could be a causal factor in chronic fatigue. Chronic fatigue often goes in hand with poor adrenal function and poor immune function. And many chronic fatigue patients have yeast infections and gut problems. So in severe cases, yeast infections can get passed on to newborn babies even. And this happens when the baby in the uterus during normal delivery has to pass through the vaginal passage that's affected by the yeast infection. So according to research I've looked at, the role of infection in miscarriage, even in miscarriage infections, can be rear their ugly head. So studies contribute chronic yeast infections as a risk factor when it comes to having a miscarriage. So therefore, it's good to have any vaginal thrush cleared up before pregnancy and to try and maintain, a healthy state that you don't obviously build a chronic yeast infection, during pregnancy. So recurring yeast infections in the mouth can cause a lot of problems too, cracking and bleeding and even sepsis if they get out of hand. So having oral thrush is not really good. So the mouth is quite a toxic place because many bacteria harbour in there, and if you've got broken skin and ulcers, it can cause a lot of problems. So how do you stop and treat the recurring yeast infection? That's the question. People often get confused if they should take antibiotics to treat yeast infections, because some doctors even give these drugs for yeast infections. Or should they take antifungal drugs? Or should they follow a more natural approach? Well, that depends on you and your goals, really. But if you're listening to this presentation, I take it that you're looking more for a natural approach because perhaps the medical approach has failed you at this point. So manipulation of the host diet can really, and particularly diet and lifestyle, can really reduce chances of developing a strong gastrointestinal yeast infection and Candida also throughout the body. So I've got quite an organized approach to treating recurring yeast infections that I explain in great detail in my book Candida Crusher, which was launched in 2013. So the course is divided into several phases, and I'm going to talk about 6 phases here for this presentation, and these phases will build upon each other and target eliminating the yeast infection from your system. So if you follow this carefully, you shouldn't really get a recurrence. So the first phase we'll talk about is starving the yeast, or taking food supply away from it as much as possible. Ultimately, in inverted commas, you can't really starve yeast because yeast can feed on many things, but it thrives on sugar the most. It thrives on processed food. So the first thing you need to do is to cut down on these foods as soon as you can and switch to a healthier diet, which I call the MEVI diet: meats, eggs, vegetables and yogurt. This is not a new diet. This diet's been around since the 70s, and it was spoken of by Dr. John Trowbridge in his yeast book many years ago. It's an excellent approach for people with a yeast infection. So obviously we're not just talking meats, we're also talking, other sources of protein as well, if you wish. So let's talk about these steps. The diet changes also call for introducing a low allergy component. So the first thing we want to do with the diet is clean up the diet, take the obvious rubbish away. So once we've got the diet cleaned up to a good state, we start talking about low allergy foods. This is because your immune system is likely being affected. This is because you may have adrenal fatigue or thyroid dysfunction or be tired. So people often stay with a low allergy approach for several weeks, but in seriously chronic cases it could be up to 12 months, but normally 3 months. It takes some commitment and patience to negotiate this diet, but it's actually quite an interesting diet. You have many food choices. So don't cheat at this stage, because you're only fooling yourself if you do that. So the third phase of the diet is a slow reintroduction of foods. Just slowly. Foods that you've taken out previously that may be on the allergenic food list. So let's jump into phase 2. You can read a lot more about the diet in Candida Crusher, or watch hundreds of videos I've completed on YouTube regarding the MEVI diet. So phase 2, we'll talk about potential die-off or setbacks that you may experience, particularly when you make these changes initially. So sometimes changes in a diet can create untoward reactions in the body, especially if you're treating the body at the same time. Now you're taking a supplement perhaps that's going to help clean up the yeast in your gut, that's going to help reduce the bad bacteria. So we call this reaction a Herx or Herxheimer reaction. So it's the body basically coming back, and it can create fatigue in some people, a bit of headache, lethargy, sometimes aching joints or bad breath. You could feel a bit low at times as your detox system starts to kick in and clear away toxins and rubbish from the body. So as Candida dies off, it creates problems for the body to deal with. It's not any different from cleaning up a dirty room and then coughing because there's all this dust in the air. So these changes are to be expected. The dirtier the room, the more you're going to cough, basically. But don't give up just because you're experiencing some of these symptoms. It's essential to continue with the program for optimal health if you're at this stage, because it means your body's working hard to clean itself up. So there are natural solutions for reducing Herx reactions. It's one of the reasons I created Canxida Remove. Most people who take Remove slowly to start with don't generally get these Herxheimer reactions unless they're taking large amounts to begin with. Sustained release supplementation is very important. It stops people experiencing too much too soon, which can create the headaches and the pain in the digestive system. So the longer a supplement spends in the digestive tract and the more slowly it breaks down, the more time it has to work, and the less likely the patient's going to get a die-off reaction. I was one of the first people to create a sustained release Candida product, and from the thousands of people who've used it, we've had this great feedback that they don't experience the die-off they did with other supplements. So let's talk about phase 3 now. Say no to pharmaceutical medications if you can. If you can, talk to your healthcare professional, your doctor, perhaps about reducing the amount of inhaled steroids you're taking, perhaps about stopping those antibiotics if you're being told to take them routinely. If you can back off those hydrocortisone creams or hormone replacement therapies, all these things that could be stimulating Candida to keep messing up your body. So following the regime I'm talking about, and under clinical supervision or with professional help, reducing these medications will go a long way to reducing the continuation of yeast production in your body. But of course you need professional help. So I'm not saying you should stop medications, I'm saying you should do so under the guidance of your medical doctor. So let's look at the fourth phase, rest and digest. Rest and digest, when you think about it, this is what the autonomic system pushes the body into the parasympathetic, and we get this from relaxation. Your immune system needs time to recover, and by relaxing more and backing off the pedal and sleeping better, you're going to achieve this objective. So I can't stress enough the importance of rest when it comes to restoring the quality of your health. I really can't. And by rest, I mean not only taking out time to, relax your entire nervous system. Your entire body needs relaxation. When you really relax on a deeper level, your immune system can start building good, strong health again. So try and avoid these foods that you react adversely to. So these foods include yeasty foods, right? Soft cheeses. Be careful of cheeses. Matured cheeses are better at this stage. Alcohol is a no-brainer. You need to keep off alcohol in these stages of the Candida crusher diet. It's not really a good thing to drink any alcohol while you're trying to restore your immune system health. So soy could be potentially allergenic for some people. Chocolate, peanuts, dried fruits, sweet fruits, including grapes. Bananas come into the allergenic category. Oranges come into the allergenic category. Cow's milk comes into it. But as I say, look more at my videos explaining these concepts on allergenic foods. So let's talk now about phase 5, allergens, chemicals and toxins. We're exposed to so many chemicals these days, and for the most part we don't really consider these chemicals in our life. When we think about chemicals, we think about industrial pollution, don't we? About smoke in the air. But think about the antibiotics in the food. If you're buying commercial poultry, there's likely going to be antibiotics in that poultry. So milk rarely gets a mention. We don't know how our body's going to respond to cow's milk. So you can read a lot more about this in Candida Crusher, about why I usually caution people with cow's milk in the early stages and pull it back. So let's now talk about lifestyle changes. Right? Sorry, with phase 5, I forgot to tell you that obviously you want to reduce the chemicals and toxins and allergens in your diet. That's part of the, building up the immune system. So personal care products, look more for organic or clean ones. Foods, look more for organic foods. Look for cleaner sources of meat, cleaner sources of milk, like oat milk, for example. So when you're reducing these chemicals in your diet, it just gives your immune system a greater chance to fight back. So phase 6 is the lifestyle changes, and think about a future for you without yeast infection. So once you see the benefits of the program I've worked on for a few years, I think you're going to find a lot of changes will come. Your body will automatically respond a lot more to positive things that you're doing for it. And what you'll find over time is you're going to crave a lot less junk in your life. You're going to not want these soda drinks anymore or sweet foods. You'll have a lot more energy. You'll feel a lot less anxious. And you'll have a more positive outlook on life too. And I'll guarantee you something. Your sleep will really improve. You'll wake up feeling fresh in the morning and not tired. So, but still there are more changes you'd benefit from making. So let's talk about those changes. What if the treatment doesn't work? What about if it's a waste of time? Well, a unique body. Your body is very unique when you think about it. So many people complain the first 2-3 weeks they're not getting the results they're looking for. So a tree's not going to bear fruit in the first 5 minutes. It's going to take time. The key is to be patient and understand that all good things will come in time. Natural treatments take longer than pharmaceutical treatments, but they're not wrought with the side effects. But if you think about it, even over-the-counter drugs take time to work. So, but if you really feel that things aren't working out for you, best thing to do is to get professional help and to seek the help of an experienced naturopath or integrative medical doctor. That is a doctor who's had experience in functional medicine. You can look up on the internet Functional Medicine Institute, I believe, in America, and you'll find holistic or integrative doctors. There are quite a few around who integrate science, Western-based medicine together with natural medicine, and there are many caring doctors out there who offer a very good approach like this. So these would be good people for you to approach. So let's look at some prevention tips now for you. An old saying, of course, prevention is better than cure. So a study I looked at suggested that prevention is the most effective treatment, in inverted commas, when you think about it, much more so than using any kind of medication. If you can prevent a condition, that's what you want. There are several aspects to consider in your daily routine that can provide a strong foundation and a protection from these infections. However, therapeutic approach is necessary when an infection is well established, and therefore, you've got to look at alternatives, of course. So let's look at some preventative measures that can be adopted by you right now. So let's talk about number one: avoid wearing tight clothing. This goes for guys and for women. I've seen many guys wearing coveralls or overalls, for example, that work in, for example, the mechanical industry, that had bad jockage because they were wearing the wrong kind of underclothing. I've seen similar things with women. I've seen several flight attendants as patients in the United States, several of them wearing nylon underclothing and then, having recurring infection. So if you've got a yeast infection in the private area, you need to avoid, if you can, very tight clothing or synthetics. Wear loose-fitting clothing made from natural fibers like cotton, for example, or hemp. Avoid hot baths and whirlpools and things like this, especially if you've got yeast infections. It's only going to make it worse. Jockage is the same. You'll just inflame the condition. Point 2, after swimming, shower and change into cotton underclothing and wear cool, loose-fitting. Always wear cotton. Third, avoid alcohol, especially guys who are prone to men's yeast infections. You'll need to keep right away from alcohol if you've got this problem, all right? I've had men crying on Skype. They had this condition so bad. It's a condition that's so chronic, it just destroys the quality of your life. And if you continue to drink alcohol and think you can get rid of this infection, it's delusion, right? This could be your singlest and biggest obstacle alone, and I've verified this with countless men. So follow the Candida Crusher program and adopt the diet correctly, and especially avoid sugars and yeasty foods. So cookies, conventional breads with lots of yeast in it, candies, soda drinks, chocolates. So the Candida Crusher book goes into food in a very big way. So point 4, avoid antibiotics for any type of illness if you can. They are one of the biggest causes of all of yeast infections. Avoid them as much as possible and only take if absolutely necessary and under professional guidance. So if you must take them, you need to really follow up with a course of probiotics. Number 5, trim pubic hair. Keep pubic hair very short and trimmed around the genital region, because if hair's too long, it just traps body heat in these areas and it keeps moisture close to the skin and an ideal breeding ground for yeast infection. So maybe time to get a good haircut. Number 6, treat for minimum 3 months continuously when you've got a yeast infection. If you've got a rash on your private area, make sure you treat it for at least 90 days. Right, continuously, 12 weeks. Keep going with it. It's common to treat a yeast infection and then eliminate the symptoms temporarily, and then it comes back with a vengeance several weeks later. Seen this time and again and again. So you don't need to fall in that trap. Number 7, try and get some swimming in salt water if you can. In summer, swim in the ocean. Keep away from sharks if possible, but I think you get my point. The sunlight on the affected area and salt water has a tremendously good effect on yeast infections. Your skin will respond well. So 2 things Candida can't tolerate at all is sun and salt water. Point 8, treat your partner as well. Right? It's highly recommended that you treat your significant other, so not to pass the parcel, as I call it, to pass infection from one to the other. Number 9, forget quick approaches. They're a waste of time. You've done this before. How many times have you treated and it came back? I've seen this with chronic cases time and again. If you've got recurring penis infection, groin infection, toenail infection, ear infection, nose infection, whatever kind of infection you've got, I've seen so many of these infections over the years. You need to do the diet and the lifestyle and the local treatment for 90 days without fail, and then keep doing it until you're well and stay well for a minimum of 6 months. Your reward will be well worth your effort, because you'll finally be rid of this infection. Number 10, coconut is a great lubricant. Use pure organic coconut oil as a personal lubricant. It's fragrant, but it's also antibacterial and antifungal. It contains components in it, different types of acids. Caprylic acid, for example, is in there, capric acid, and these things kill fungus. So this is a good way to stop passing infections from one person to another as well. Use coconut oil. Number 11, keep your hands and feet clean and dry and warm. So, but we're not talking sweaty warm, we're talking, look after your feet. Keep the toenails trim. Clean the spaces between the feet. Wash your feet regularly, and hands, especially if you're prone to infections on the hands and feet. So, no dirt. Wash the hands. Fungus loves dark, moist and warm areas like sweaty hands or gloves, or replacing socks is very important. Every time I see a guy or a woman with a suit on with a toenail infection, I ask them how often they walk around bare feet. I was at the beach one day with my wife and I saw a guy in a suit wearing shoes and walking along the sand, and I thought, this is crazy. So when you can, walk bare feet. Expose the feet and the nails to air and sun and salt water. This is going to really get rid of infections. If you've got a bad toenail infection you can't get rid of, ask yourself, how many hours a day do you walk around in socks and shoes? Right? Number 12, always wear cotton socks, especially if you've got an existing fungal nail problem or athlete's foot. Change socks twice a day. Try and wash your feet at least twice per day, and carefully dry, very carefully dry with a towel, even a hairdryer. So add a little bit of Australian tea tree oil. Thursday Plantation is my favorite brand. Add 1 drop in your shoe, perhaps once or twice a week. This is also going to help quite a lot. Number 13, we've got observe excellent oral hygiene. So to avoid reinfecting yourself when brushing teeth, try disinfecting the toothbrush by placing it in some hydrogen peroxide for a few minutes, because this will really help to reduce the yeast counts on the toothbrush, and it will greatly prevent reinfection and also any oral kind of issues that you could be experiencing. Point 14, for oral thrush, zinc and vitamin C lozenges work quite well. They heal many different kind of oral issues affecting the mouth, the gums and the tongue. So I highly recommend these lozenges for sore throats or mouth ulcers, for example, poor oral immune function. Even cold sore outbreaks are going to work quite well for too, or influenza. So suck on one of these lozenges maybe every 2 or 3 hours, and you'll often get a lot of relief for that. And point 15, avoid cotton diapers and plastic diaper covers if the child has a diaper rash. Use disposable diapers until the rash is fully resolved, and make sure these diapers are changed regularly. They make diapers quite well these days that keep moisture away from the skin. But if you want to go back to cotton, you need to do that when the rash is all cleared up. And remember, sunlight and washing and cleaning will help significantly, of course, to improve this condition. So let's talk now about how to manage chronic yeast infections and how to deal with it when you get symptoms and flare-ups, these sorts of problems occurring. So preventative steps usually put people in a better position when it comes to handling chronic yeast infection, but sometimes people miss out on these and their chances of getting yeast infection increases again. So in such cases, it's not really good to get nervous and anxious about this. It's good to keep cool and calm and face this infection in a more organized kind of a fashion. So according to Dr. Moore, an OBGYN, Sapphire's Women's Health Group in New Jersey, she mentions that stress is always a factor for chronic yeast infections. And this is something I can certainly agree with, and I've seen in my clinic time and again. Dr. Moore goes ahead to say that there aren't any great controlled studies to prove that, but the years of experience make the relation a bit clearer every day. This doctor further adds that stress release hormone called cortisol elevates blood sugar and heightens the chance of a yeast infection again. This is exactly what I was saying before about a cortisol increase and spike with stress. So the more you stress, the worse the infection gets, both because you're giving it more sugar to feed on, and also you're lowering the immune system's effectiveness further. So this is not a good way to deal with a chronic infection, is to get further stressed. So Dr. Moore agrees that to deal with a chronic yeast infection, you should always learn to de-stress. The further steps include starving the yeast by eliminating sugar and highly processed foods from your diet, which are a given. But keep in mind, you've been through this again, and sometimes again and again, but you will come out stronger in the end. You can use medications you've used previously to get some relief, but sometimes you need to make changes if things aren't working out for you. Some yeast infections become resistant, however, to medication and diet. So the key is to prevent is to switch the medication and diet and keep the doctor in the loop. So here's a few tips on how to improve chronic yeast infection management, right? Keep your supplements handy. The things that you're going to take regularly, keep them there. Try and make a journal or checklist of your symptoms for a faster diagnosis, right? Listen to what your body's telling you. If you're tired, you need to rest up. If you've got energy, you can go and spend it within reason. Don't skip on supplements. Don't take too much, but take quality ones. Canxida Remove and Restore were designed especially for men and women's yeast infections. You can try those, or you can look at other products. It's all up to you. There's no pressure. Try and remain positive at all times and stay calm. And if you're really worried about things, it's probably best you talk to a healthcare professional. Don't wait for the infection to get treated. Try and make the diet and lifestyle changes right now, before anything else. Double check all your hygiene factors, undergarments, and keep the private areas clean and dry, changing pads and tampons and things like that we spoke about. Read the signs and symptoms well in advance if you're vulnerable to having recurring yeast infection. If you can't treat it successfully at home, contact your healthcare professional straight away so you can get onto it before it becomes a really bad problem. So when do you see a doctor? The yeast infections are very personal. I can totally appreciate that. And sometimes people don't want to see doctors, they want to self-treat at home. Sometimes yeast infections flare up really bad and they can spiral down just as quickly. If preventative measures don't stop your recurring infection, then it's safe to say it's time to reach out to the doctor. You may have some usual or unrelated symptoms even, right? There could be mucus in the stool, there could be very aggressive rashes, you could have gone right off your food and lost all appetite, or anything's possible. Don't wait for signals. If you've got a chronic problem, you need to seek professional help then, especially if there's that little inner voice says something's not right. So let's talk now about some FAQs. As we head towards the end of this video, I'd like to answer some very critical questions that people have been asking. So let's get started, all right? Why might a yeast infection last longer than usual? A yeast infection might last longer than usual because of a variety of reasons, some of them being a weak immune system. There could be medications or pharmaceuticals interrupting the recovery, perpetuating the condition. There could be underlying health problems that haven't been assessed properly. There could be age-related problems, for example. Next question, is age a factor in a recurring yeast infection? Not really. Anyone's susceptible, from the young to the very old. Why do I still feel so bad after doing all these changes and I'm still getting recurring infections after 3 months? Well, as I've discussed previously, treatments and preventative measures for yeast infections might not work for some people. In such cases, it's recommended highly that you make some stringent lifestyle and diet changes. Taking some supplements like Canxida, for example, consulting a doctor if you notice unusual or prolonged symptoms that are really upsetting you. So, what about tanning beds? Do they cause a problem with recurring yeast infection? Can high doses of birth control cause yeast infections? Yes. High doses or the prolonged use of hormones are implicated in recurring vaginal yeast infections in particular. Many studies I've looked at validate that yeast infections can be prolonged or more severe with, when a person's on birth control. Can hormonal imbalances cause a recurring yeast infection? Yes, they can. Increased levels of estrogen before the menstrual period can be a causative factor in increasing the likelihood of developing recurring thrush. And we said that before, that estrogen can stimulate sugar production in that area, which can boost the yeast growth and output in that area as well. Can low estrogen cause recurring yeast infection? Yes, having high or low or imbalanced estrogen can make you more prone to a yeast infection. Low estrogen frequently leads to vaginal dryness and frequent UTIs or urinary tract infections. And yeast infections are common due to changes in the genital area because of diminished secretions, and changes also in the pH balance of this vaginal area. So this will be noticed in particular before the cycle or around menopause. It is this loss of natural lubrication that causes the dryness, and these changes can lead to increased yeast as well as other types of infections like bacterial infections. Can recurring yeast infections affect a person's sex life? Yes. Both men and women can experience sexual discomfort and fatigue if they've got Candida yeast infections. Can wearing jeans without panties cause recurring yeast infections? Not really. It's more likely to occur if one is wearing underclothing and in nylon over cotton, even more so. Can yeast infections spread to the nipple area? Well, yeast infections of the nipple can most certainly be a common factor with some women. Around breastfeeding, for example, and this can cause the nipple to bleed, and it can cause increased levels of itching and then scratching, which can make a person want to, scratch that skin and lead to an infection again. What's a good probiotic for recurring yeast infection? Yogurt is one of the best natural probiotics. Sour Greek natural yogurt without sugars, any added sugars in it. Is Canxida Remove a good supplement for recurring yeast infection? Yes, it is. Canxida Remove is a perfect blend of natural ingredients that's highly potent and contains antifungal, antibacterial, and antiparasitic formulations that help in eradicating yeast infections, and have done so now for several years. How to heal recurring external yeast infection under my breast? Follow the Candida diet. Take the supplements like Remove and Restore to eradicate the yeast naturally. I keep getting recurring yeast infections with my new boyfriend. Could this be an issue with him? Or what does he need to do in order to treat this infection? The boyfriend would likely need to go to a healthcare professional and have a consultation and an assessment to see if there is a problem with a yeast infection. Can antibiotics cause recurring yeast infections? Yes, they can, in many different parts of the body. The longer you stay on an antibiotic for, the more severe the yeast infection can be. Can waxing cause recurring yeast infections? Not really. This is because waxing removes hair, which has actually got the potential to trap heat and cause the infection. So waxing in the groin area is more likely to reduce the possibility of yeast infection because it makes it area to keep it clean and dry. So it should actually be a bonus, not a negative. Can a vaginal yeast infection be passed to a man and cause a prostate infection? Males can be affected by yeast infection if their sexual partner is already affected. And if the infection remains untreated for a long time, it can cause prostate problems. I've seen some seriously bad prostate infections in men that were caused due to vaginal thrush over the years. So it pays to get these infections treated sooner rather than later. Can untreated recurring yeast infection cause health problem during pregnancy? Most medications for yeast infections from the doctor, you're not recommended to take those when you're pregnant. So it pays to talk to a medical doctor in these situations. Can untreated recurring yeast infection lead to pelvic inflammatory disease? If vaginitis is left untreated, it can cause PID, which can further then go on to be an issue regarding fertility and even pelvic pain in women. So it should be treated again sooner rather than later. Can a recurring yeast infection cause spotting in women? Small cuts and inflamed tissues can cause bleeding or spotting if you've got recurring yeast infection. So yes, there is a possible link there. Can a change of hormones cause recurring yeast infection? Most definitely. Elevated levels of estrogen are frequently to be found one of the major causes of vaginal yeast infections in women, and this can occur during pregnancy, taking the pill, before the period, or hormonal fluctuations around menopause. Can codeine cause a recurring yeast infection in women? Codeine can cause allergic reactions around the mouth, rashes on the skin, and is also linked with constipation, sluggish bowel, and even liver disorders. So you need to talk to your doctor if you experience symptoms around codeine. Can the estrogen pill cause recurring yeast infection? Estrogen is a prescribed pharmaceutical drug that contains estrogen similar to those produced in a human's body. So people can use topical on the skin forms of estrogen, or oral, tablets to treat some symptoms associated with loss of estrogen around menopause, which includes symptoms like hot flashes or inflammation of the vagina that can sometimes result in pain. So there are many potential side effects, but estrogen is certainly linked up with recurring yeast infection. So if you are on estrogen pill and have a yeast infection, it always pays to see your medical doctor. Right, now we've come to the conclusion of this comprehensive video on chronic yeast infections, men and women's yeast infections, but advice can relate to many other types of yeast infections. So if we do a quick recap, we talked about recurring yeast infections and what causes them to become truly chronic and recurring, ongoing. We also talked about the risk factors of not treating the infection timely, what can occur. As per usual, it always pays to get a problem sorted sooner rather than later. And one thing I've stressed in this video, which I stress in all my videos and in my book, it's necessary to make the lifestyle changes as well as the diet changes in order to keep the infection at bay. So while I'm addressing all this, I'm also aware that treatments might not work adequately or fully for some people, and flare-ups can be really taxing on your physical and mental health. There's no doubt. But if you have a good plan sorted before you go into this yourself, it's going to really help you in the long run. I've tried to personally answer all the questions I've been commonly asked both by my patients and from the wider public. If you have more questions, please check the links provided in the description box below. And if you liked this video and found it helpful, please leave a comment and share this presentation with other people who might find it useful. Thank you for tuning in.